Good evening, everyone. This is Esteem Radio Vision, located at Obokun, Ilesha, Osun State. We are welcome to another edition of Health Corner, where we enlighten you guys and inform you, and also help you make healthier choices. And we are to welcome our executive producer in person of Deacon Michael
Adeboye
Ashaolu.
I always double with the founder of any Akmonle Foundation that proudly sponsored this program.
Yes. So this program is to enlighten you and to also make you make healthier choices. So today we'll be talking about cancer. And we know most of us, we've heard of it, but we don't fully understand what it is all about.
You know, somebody like me, Olamide, when you talk of cancer, as a psychologist I am, the cancer is one of the zodiac signs for you to know maybe this one belongs to this. As far as astrologist is also concerned, what we know cancer for is different from what health practitioners knows cancer for. That is why we want to look at that topic today.
Yes, and today we invited a professional nurse who has been in the business in the field for so long. Nurse Nwoko Ezinne, Mary Constance. She's here to enlighten us and to also make us understand what cancer is all about. You are welcome in our midst today, ma. Good evening, ma.
Good evening.
Yes,
thank you. I'm glad to be in your midst.
Yes, ma.
I'm glad to be here too.
Yes, ma. Ma, what is cancer all about, ma? We want you to explain to people out there that doesn't really understand what it entails, ma.
Like somebody like me, as a psychologist, who believe that cancer is one of the zodiac signs. Yes. But you, as a health practitioner, how can you define or describe cancer?
All right. Well, what you know cancer as for in astrology is not what it is medically. It's a different thing altogether. So cancer medically is a group of diseases where abnormal cells grow uncontrollably and spread to other parts of the body. Normally cells grow, divide, and die in orderly way. But in cancer process, the process is distorted, it breaks down, and it now leads to something like uncontrolled growth, formation of tumors, damage to organs and tissues, possible spread to other parts of the body in a process known as metastasis. So that is what it's all about. So cancer is a group of diseases where we have abnormal growth of cells that grows uncontrollably and spreads to other parts of the body. That's what cancer is all about.
Okay, from your definition or from your explanation, you said it damages organs and tissues. What type of organs are you talking about, and which part of the tissues are you talking about that cancer can damage? Is it all, or there's some specific organs?
Okay, like organ like the breast. When you have a breast cancer, it can damage the organ that's the breast. It can damage the breast. So that was what I mean by damaging organs. And when you talk about the tissues in the body, if it is a prostate cancer, it can damage the tissues of the prostate cancer, tissues around the prostate in a male. It can damage it. That's what cancer does. That's what I mean by damages to tissues and organs. Anywhere it occurs, it damages those tissues and organs, making them no longer functionable.
Okay. Now, I want to know, is it general, or we have it in different types or kinds? Because some people are having it, but they didn't know what type of cancer they have in their body.
Okay, there are so many types of cancer. There are about 100 different types of cancer, including breast cancer.
Sorry, you said 100.
Yes.
I'm scared now. We got hundreds of. Okay, because of our time,
there are so many.
Cannot look at all the types of cancer, but let's look at some of it.
Yes, we have something like breast cancer, we have lung cancer, we have prostate cancer, we have cervical cancer, and a lot more. We also have what is known as leukemia. Leukemia is the cancer of the blood.
Cancer of the blood.
So there are a lot of cancers. Yes, cancer of the blood is known as leukemia.
Okay, now if someone have cancer in any part of his or her body, I think that one we can the doctor can still operate that part of the body and remove the cancer. But you talk about the leukemia, that is cancer of the blood. If someone have that cancer of the blood, what will happen to such person?
It's a very deadly type of cancer. So what normally, it depends, cancer is being treated not only surgically, it can be treated with drugs as well and radiotherapy. So for that, in the case of blood cancer, chemotherapy or radiotherapy chemotherapy can be used to treat it instead of surgery, because you cannot remove the blood now. You cannot do surgery in the blood.
Oh.
Yes.
Thank you for that, ma. Now, what are the causes
Yes.
and the risk of having cancer, ma?
Well, cancer does not usually have one single cause. It does not have one cause at all. It comes from a combination of genetic, lifestyle, and environmental factors, And some of those factors include, when we talk about lifestyle factors, we talk about smoking and tobacco use, talk about excessive alcohol intake, talk about poor diet and physical inactivity. We also talk about obesity. All these factors, all these lifestyle factors can cause cancer. Another one is environmental factors. If you are exposed to radiation, harmful chemicals, or air pollution, it can lead to cancer. Another type is biological factors. When you have a family history of cancer or genetic mutation, it can lead to cancer. We have infections such as HPV, which is herpes, human papilloma virus, or hepatitis B and C, can also lead to cancer. Then age. As one gets older, the tendency of one getting cancer becomes higher. It increases. So age is a risk factor to cancer. Thank you.
Okay, with this you talked about I want us to look at the environmental factors now. Okay, for instance, now you say harmful chemical. For someone who loves to have his meme, or you have a kind of food that, okay, if you want to put it on, you want to warm it, you love to warm your food or to cook your food with plastic. Can someone if in such, in that situation, can someone having cancer through that, using the plastic that contain chemical? I want to know, because with the type of cancer you mentioned, I'm scared. That is why I'm asking this question, so that I will know what to do personally. And I know some people are there who would like to ask that particular question.
Yes, that is why there is a particular type of food we call moi moi, whereby some people use nylon and plastic plate to prepare it. It has been observed that when plastic or nylon is subjected to heat, it releases some of these chemicals. And these chemicals, as we continue to consume those food prepared with those plastic and nylons, over time, the person can develop cancer of any part of the body. It's a harmful chemical, so it can cause cancer. Thank you.
Okay, air pollution now. Okay, if I pack all my waste and I want to burn it, and I burn it in an open place, is it harmful to, is it part of what we are called air pollution, or I want to understand it?
Yes, it is, because it can affect the lungs as you are inhaling those pollens, as you are inhaling those combustive air. You are inhaling unhealthy air. It can goes down to the lungs and cause lung cancer or any cancer of the body. So air pollution is a harmful, is part of the environmental factors that can lead to cancer.
All right, ma. Thank you, ma. Ma, what are the symptoms
Yes.
people have when they have cancer? The symptoms they have.
Okay. The symptoms vary depending on the type and location of the cancer. But there are some common symptoms which one can see and suspect cancer. So for women, when they have breast lumps, because there is what we call breast self-examination. We teach women to do breast self-examination every month after their menses, so that they will know if there's a lump in their breast, because it is those lumps that usually develop into cancer. So when you see something like lumps or unusual swelling, is a sign or symptom that there's a possibility that cancer is coming up. Then unexplained weight loss. All of a sudden, somebody starts losing weight without any health issue. Is a suspect. It's a suspicion that is one of the signs and symptoms that it could be cancer. Though not all weight loss is due to cancer. You can have other things as well. But when you have weight loss without any other underlying disease, you can suspect cancer. Then when you have persistent cough or difficulty in breathing, it can also point to cancer brewing. Then abnormal bleeding. When someone is bleeding unnecessarily, there's a possibility of cancer, especially cancer of the reproductive organs. Then chronic fatigue. What I mean by fatigue is from time to time somebody feels so weak, feels so tired, and it happens all the time. Chronic, as the name implies. It's also an indication that cancer is somewhere brewing. Then changes in bowel or bladder habits. Maybe when you are used to going to toilet once in a day, it now changes to 2 times or 3 times in a day, or even or just any change at all in your bladder and bowel habits. And maybe if it is bladder, you go to urinate 3 times or 4 times a day, it now changes to 10 times a day. It's also an indication that you should watch out if cancer is on the way. You can also go to your clinic when they do a physical examination or all the tests. We'll talk about that later. Then you find out whether it's cancer or not. Thank you.
Okay. With your response about the symptoms of the cancer now, how can it be diagnosed if someone wants to diagnose cancer?
Well, like I said before, for breast cancer, there is what we call physical examination. Then for leukemia or blood cancer, you have blood tests. You have also imaging scans, something like CT. What we mean by CT is computed tomography. Then MRI, what we know as magnetic resonance imaging. Then X-rays and ultrasound scans. Then we also do biopsies. In biopsy, what I mean by biopsy is we collect small tissues and examine them under microscope to know if they are cancerous. So those are the options that can be used to diagnose cancer. You can diagnose it through physical examination, blood test, imaging scan, and biopsy. Those are the 4 major ways you can detect cancer or diagnose cancer. Thank you.
Okay. Thank you for that beautiful response. Now, in your response, it seems you are more concerned about women, because most of the area that you are talking about, or part of the body, is what matters to women. I want to ask this question: which one is common to men? I mean,
Men also have what we call prostate cancer. There's an organ in the reproductive organ of a man that is known as the prostate. So they also have what it can cause with age over time, it can become cancerous. So, and it's also this biopsy we are talking about is usually for that type of cancer. That's how you get. That's how you diagnose that kind of cancer. You diagnose it through biopsy. You collect small tissue of that prostate and go examine it under a microscope. Then you find out whether it's cancerous or not. So, but before then, it will be giving the man some symptoms. It will grow abnormally, then occlude the urinary. Men, the reproductive organ and their urinary system is almost at the same point. So it will disturb the person's urination. It will cause difficulty urinating, dribbling, frequency, and all the rest of them. So with that same signs and symptoms, and also unnecessary growth, all those you can feel some growth around there, then that can warrant the man to seek for medical aid. By so doing, they can diagnose or find out if it is cancer or not. Thank you. So I'm not particular why I talk about it, breast cancer in women, because we do it through physical examination. We can also do this. We can also do biopsy for breast cancer, except especially when after removing the lumps. You can also you collect a sample from the lumps and subject it under microscope to find out whether it's cancerous or not. So I'm not talking about women alone. All these other physical tests, blood tests, imaging scan, and biopsy, they are all for both men and women. Just that breast cancer is particular for women, then prostate cancer is also particular for men. Thank you.
All right, ma. What are the treatment options?
All right. We have a lot of treatment options. First of all, you talk about surgery. In surgery, if it is a body part that can be removed, something like the breast, the prostate, the the tumor, if it's a tumor in the brain, it can be removed. So surgically, you can remove it. So surgical removal of any affected tissue. Then we also have chemotherapy. Chemotherapy means the use of drugs. We have chemo drugs. We have drugs that can take care of cancer. We call them chemotherapy. By the use of drugs, we call it chemotherapy. Then also you have radiotherapy. Use of the radiotherapy means use of high energy rays to destroy the cancer cell. In this case, you target the site that is affected and subject it to high energy rays that will kill the cancers. Then you have immunotherapy. Here you boost immune system to fight cancer. Then you have targeted therapy. It's also use of drugs. But these drugs now, you subject it to the affected place. You don't give it as a general medication in chemotherapy. So this targeted therapy, drugs that affect the specific area are, the cell, you use it for that particular cancer. So if it is a let's say cancer of the, what will I say now? Or maybe one of the fingers or one of the legs is affected by cancer, you now target that particular place and give that therapy. Then you talk about hormone therapy. In this place you use hormones to take care of this kind of those cancers that are affected by hormones, that are like something like the breast cancer or prostate cancer. You use hormone therapy to take care of it by using hormone, because all this type of cancers, breast cancer and prostate cancer, they respond to hormone. They use hormones, like in the breast, the oxytocin and the prolactin acts on the breast. Then the prostate also has its prostaglandin, its own hormones that also act on them. So all these ones that are hormone that needs hormone therapy, it can be treated with hormone therapy. So we have like up to 5 options for treatment options. So you talk about surgery, chemotherapy, radiotherapy, immunotherapy, targeted therapy, and hormone therapy. Thank you.
All right. Thank you, Ma, Nurse Nwoko. I want to be clear with this. There is a general saying that prevention is better than cure. Now, how can someone detect early and prevent cancer?
Thank you. That's a very nice one. You can actually prevent a lot of things by doing simple things that we neglect. Very simple things that we neglect in our everyday life. Those are the things that you can do to prevent or detect cancer early. Because one thing with cancer is if you detect it early, then you are sure of getting 100% cure. But when you don't detect it early because of the poor lifestyle and all the rest of them, you find out it's a problem. So you can prevent it and detect it early by what? By first of all, eating healthy and regular exercise. You eat healthy food and do exercise. We talked about exercise. Exercise is very good. It's a very good thing for our daily living. Then we talk about avoiding smoking. If you are a smoker, you quit smoking so that you protect your lungs, because that smoking actually affects more of the lungs. It actually causes lung cancer. Then you limit alcohol. Alcohol can cause liver cancer, liver cirrhosis, and all the rest of them. Then regular screening. This one help you to detect early if there's anything. And the things we can do, some of the screening you can do regularly are what we call mammogram. Mammogram is a test for the breast. pap smear. Pap smear is a test for the cervix. Cervix is a part of the reproductive organ of a woman. Then colon cancer screening. This colon cancer screening is a screening of, the colon is part of the GIT, digestive system. So cancer can occur there. It's also a common place where cancer can occur. So if you do a screening for them regularly, you'll be able to detect it early. Then you also do vaccination. Make sure you do all your vaccination, especially HPV and hepatitis B, because this, if you don't take the vaccine, it could be predispose you to cancer, especially in women. This HPV, known as human papilloma virus. This human papilloma virus can affect the cervix and cause cancer. Then you protect the skin from excessive sun. Like in these are tropical area, during dry season, like as we are now, the sun used to be very scorching. You find out some people, they will just be going, they will say, they are black, nothing. Because the ultraviolet rays from the sun can actually cause harm to the skin, especially those that lack melanin, the fair skin people, because what makes them to be fair is that some of them lack melanin. That's what the hormone they call melanin, especially the albinos. They lack melanin. So if they expose themselves to the sun, it can cause skin cancer. So regular exercise, eating healthy, avoiding smoking, limiting alcohol, regular screening, vaccination for HPV and hepatitis B, and also protecting ourselves from sun exposure, especially sun exposure. All these practices can help detect and prevent cancer early. Thank you.
All right, man. Thank you so much for that. Man, do you think cancer have emotional and social impacts?
Very
Does it
well.
have? Okay.
It has a huge social and emotional impact. It affects more than the body, you know. It can lead to emotional stress and anxiety. Just may mention, I heard the moderator saying that he's afraid when I said we have up to 100 cancer. That one alone is let alone when someone is diagnosed of having one of them. The anxiety alone can kill the person before you start treating the person. Then it also has financial burden, because when you talk about surgery, the surgeries are not 1 naira, especially when the person have brain tumor. If it's cancer of the brain, because you can have cancer of the brain, and maybe you remove the tumor inside the brain. It's a lot of money. It entails a lot of money. So that's burden. Or maybe you want to do even common breast cancer. You have both emotional stress and financial burden. After the financial burden, you find out yourself you can no longer look like a normal woman. You have to get extra breast, or leave your breast flat as a woman, which can give you emotional concerns. So those are the things. It has both emotional stress, anxiety, and financial burden. Thank you.
Okay, thank you. Before we conclude on today's topic, I want us to deep, dig deep about the financial implication if someone is having a cancer. Maybe this will help individual to prevent it. I want you to talk
Hmm.
more about the financial implication of having cancer. For like someone like someone want to operate breast and the tumor, that is the one you talked about. It will cost, like, let's have the rough estimation. It will cost like how much Nigerian money?
Well, it runs in millions. It runs in millions, and it depends on the surgeon. It runs in millions. It's not 1 naira. So it's not something you even think about. Because if you don't have up to millions in your account, forget about it. You cannot do something like brain tumor. You cannot remove some brain tumor from the brain. No surgeon will go into the brain without collecting at least, talk about 10 to 15 million for the cheapest ones you can get. Not to talk about, because some people may refer you after the CT or MRI. If he's not a good surgeon, he might refer you abroad, India, or all the rest of them. The cost of going there and flights and all the rest of them would even increase it the more. It can get up to as much as 50 million. You know, so that is the thing.
Okay, what is the chances of having operation, cancer operation? What is the chances?
Of survival?
Yes, of survival rather.
Yes. Well, if it's done by a good surgeon, your chances of survival, before you book you for surgery, you'll be sure that it's something he can do. But the chances of survival, there are a lot of implications when it comes to surgery. You have anesthetic implication, you have the surgical implication, you have the health status of the person. Those are the factors you consider. So if the person age is still a young person, the chances of survival is almost 80%, Then, but if the person is older, the chances of survival is less than 50%. So, but if the person is in the hands of a good surgeon, before he or she will subject the person to surgery, we'll be sure that after the surgery, the person can live a normal life. Because there's no need doing a surgery, and at the end of the day, the person doesn't live a normal life, or the person, dies at the table. It doesn't make sense. So those are the factors they need to consider, and before they go in to do surgery, or else, what another alternative is for them to do radiotherapy or chemotherapy. If they find out that removing the organ entirely might affect the person's life, they can go for chemotherapy or radiotherapy, depending on where the cancer is located. If it is something that, so it all depends, fall within the jurisdiction of the surgeon or the expert doctor that is managing the case. So, but the survival rate generally is good, especially when it is detected early. If it's detected early, the chances of survival is close to 80 to 90%. But when it's detected late, the chances of survival is very poor. The prognosis is very poor. So that is why we talk about early detection, that's, so that you'll be able to come out with a good prognosis. Thank you.
All right, thank you. Your word encouragement for the cancer patients, and for those who have not been diagnosed as a cancer patient, what your word of encouragement?
Well, cancer is a major health challenge, but it's not a hopeless one, because these days there is a lot of research going on. So these researches, with the help of early detection and the treatment available, you see all the list, almost all the 5 options for treatment I mentioned. All these things can help save life. It has been saving life because without the help of all these things, lives, especially now, the recent times, millions of life have been saved. So by spreading this awareness, especially as we are doing to rural areas, so that especially young girls, I would like a situation whereby after this lecture, those are listening to us, they will know about how to do their self breast examination or testis examination for male. You are asking me if I'm particularizing it to women, but I would like the men also to know, because I'll talk about it maybe after this particular talk, so that anybody listening can know that there's a way you can dictate it, because we are talking about early detection, which is very important. So by spreading this awareness as we are doing, encouraging healthy habits, and supporting those that are affected, especially those that are already diagnosed, we can contribute to a world where cancer becomes less deadly and more manageable. Because these days, cancer, when you say somebody has cancer of this place, there is this fear that all hope is lost. But it is not so. If it is detected very early, well, the chances of survival is still 80 to 90, like I said. But if it is detected late, that's where the problem is. That's where the fear is. So with the help of early detection and treatment available, millions of lives have been saved, and more can be saved by this awareness we are creating. Thank you.
All right. Thank you, Nurse Nwoko. We really appreciate you for your time. And to all our viewers, this is where we are going to draw the curtain on today's episode of your favorite program, Earth Corner, on Esteem Radio Vision. Paraventure,
I
you
said
have.
something. Excuse me.
Okay.
Excuse me. I said something.
Mm,
I said I would like our viewers. I just want to quickly chip in. I
mm.
would like to tell them how to do self breast testis examination, just briefly before we conclude.
Okay, all right. Let's quickly
Okay,
have it.
so for the women, you can stand on a mirror, in front of a mirror, or lie on your back with one of your hands raised up. If you're examining your right breast, you raise your if you're examining your right breast, you raise your left. If you're examining your left breast, you raise your left hand up, use your right hand, and massage it in a circular form. You massage it in a circular form. If you feel any lump, report to your healthcare provider. You do the same thing for your right breast. If you're examining the right breast, you raise the right arm up so that your breast will be flat on your body. You use your left hand to massage it right in a circular form, to make sure that you can feel anything that is in there. And when you feel any lump, report immediately to your medical personnel so that they can remove it. Then for male, you have your testes. What I mean by testes, you know the scrotum now.
Yes.
Yes, the scrotum. I don't know how to explain it again. You go under a warm shower, then cup it with one of your hands. If you are examining it, you cup it with either your left. If you are right-handed or left-handed, use the hand that you are using. Then you use the other hand to kind of rub it use the index finger and the thumb to rub it in a circular form. By so doing, you are trying to find out if there is a lump or anything growing or abnormality. Why you are doing it under a shower is because it will make you to relax. It will cool your body and make you to be relaxed. So these two things are what I want our viewers to go home with, at least the young girls and the young boys, to go home with on how to examine themselves. Thank you.
Okay, with this take home, I have two questions. One for men and one about women. Let me start
Okay.
from, ladies first. Let me start from women. There is a general saying that even as a, how will I put it, the mother who is breastfeeding, some people say that when you are breastfeeding, if your child is sucking your breast, that will reduce the tendency of having cancer. Or if your husband is doing same thing, is this statement true? I want to confirm this, you as a health practitioner.
Yes, it's 100% correct, because studies have shown that mothers that breastfeed their baby have lesser risk of developing breast cancer.
Okay.
All
right.
It's a correct notion, yes.
Okay, now I want to confirm this too.
That's one of the importance of breastfeeding.
Okay.
That's one of the advantages of breastfeeding.
Okay, now I want to ask this. This one is pertaining to men. You talked about that examine one's scrotum, that if you are under cool condition, under shower, for instance, now someone now trying to confirm, and he discovered that one of the ball, let me put it that way, I don't know the name you call it, in that scrotum, one is bigger than the other one. Is the person safe from cancer?
Well, that is a cause for alarm, because it's not especially when it is excessively big, not slightly bigger. Because the testis is called the testis, the balls is called the testis. What is housing them is the scrotum. If two of them together is known as the scrotum in that bag, then each of them as a ball is known as the testis. So if you use the thumb and the index finger to roll it as a ball and find out it is irregular or bigger, or is a concern for him to go and report to the healthcare provider, then from there they will take it from there. They can now take a sample to find out if it is cancer growing or not. So it's a cause for him to report to the hospital. That is the essence of this test. That is the essence of this self-examination I talked about. So because when you are doing it on regular basis, you'll be able to know my test is not bigger than this other one before. What happened now? I need to go and see a medical personnel. So that's the thing. It's an alarm raising uh, uh, something that can raise an alarm. It makes you to raise an alarm on time because we're talking about early detection.
Mm.
Thank you.
All right. Thank you, Nurse Nwoko, Ezinne, Mary Constant, for your time, and to all our esteemed viewers, we say thank you for staying to us to the end of the today's episode. Paraventure, like I said earlier, you have a question that you want to ask, you can send it at the comment section, and also you can call the studio line, that is 0916 0916 that is the studio line. You will see the studio line on your screen right now. You can call that line, or send your message, your question as a text, either on the SMS or on the WhatsApp. The nurse will reply you based on your question. On this note, we are saying thank you once again. This is here we are going to draw the curtain for today's program, and many thanks to the executive producer Deacon Michael Adeboye Ashal, who is also the founder of Eni Akmole Foundation that sponsor this program at corner on Airsteam Radio Vision, located at Obokun Avenue, Ilesha, Osun State. Also, many thanks to our man, the man behind the console, Balogun Abdesama. Thank you for your effort. We really appreciate you. And to all the esteemed staff, thank you for your contribution so far. We really appreciate you. And I have with me, I want her to introduce herself as we are going for today.
I still remember myself, Olamide Arubuola.
Okay, thank you. That is Olamide Arubuola. My name is Adenipekun Afolabi. On this note, I'm saying to you, bye for now. And make sure that you don't eat from the plastic, especially when it is under heat. Like what our nurse informed us that it is dangerous to our health. Let's do away with eating something from the plastic or nylon, especially when it is under heat condition. Stay healthy. Bye for now.
Bye.
A brighter, healthier life, starting one small step at a time.